Welcome to the Safety Share, a webinar series brought to you by CIM Magazine and the CIM Health and Safety Society. I am your organizer, Michelle Beacom, Managing Editor of CIM Magazine. Today's presentation is episode 1 of season 3 of the Safety Share, and it is CIM Health and Safety Society collaborating on the journey. Today's webinar is sponsored by Eldorado Gold. Just a little housekeeping before we get started. To ensure that you have optimal audio, if you joined by computer, please make sure you've selected the computer audio button. If you joined by phone, please make sure you've selected the phone button. If you have any questions during the webinar, type them into the question box under the GoToWebinar control panel under the question mark. And just note, went the wrong. I'm going to introduce Jon in a second, but if you have, just note that we have some poll questions, so pay attention. Now I'm going to introduce Jon. I'm very happy to have him with us both as host today and to help make this series happen. Jon is president of Automate Mining and is a practice speaker and advocate for safety and incident prevention through design. Welcome, Jon.
Thanks, Michelle, and thanks Eldorado for sponsoring the first episode of the third season. Looking forward to the great session today. We've got Glenn Lyle, who's the past chair of the Health and Safety Society for CIM. Glenn's a director at Merarco and has a passion and focus on risk management and critical risks within the industry. And besides being involved in CIM through the Health and Safety Society, he's also involved in part of the Maintenance Engineering and Reliability Group. So just a quick introduction to Glenn. Maybe Michelle will move over to Bryan's introduction. And Bryan is currently the vice chair of the Health and Safety Society for CIM, and in May after the general meeting will take over as the chair. So looking forward to that. Bryan is with WSP, just recently took on the role of North Ontario marketing lead. So congratulations on that, Bryan. But his background has mostly been in safety, health and safety with WSP, others in the industry, and he's a registered safety professional within the Canadian organization. So looking forward to everything that's going to be covered today. And, great to have both of you on the line. Unfortunately, Samantha Espley, who's the current chair, couldn't make it. And Bryan, you and her were on the program a couple of years ago, in December of 2023, talking about the society. We'll get into some of those details, but maybe if you want, Bryan, just give the audience a little bit, what is the Health and Safety Society within CIM, if you could?
Yeah, sure. Thanks, Jon. So yeah, for those of you who aren't familiar with the CIM's Health and Safety Society, it's actually a pretty neat little organization within CIM. It's the only national health and safety group in Canada with individual membership that is focused on the mining industry. And so it came about through the CIM Health and Safety Committee a number of years ago, and we've been a society now for close to 3 years, probably about 3 years. And really, it's just we're a group of like-minded individuals. Some of us are health and safety practitioners. Some of us are executives in mining companies. Some of us are just other stakeholders who have an interest in the overall well-being of miners. And we come together to share knowledge through the society and really just try to advocate and work towards the journey to zero harm with our industry partners. So that's a little bit, about the society and kind of at a high level what we're trying to do. And if people are looking for ways for how they can get involved, there's lots of different avenues. Now that we've matured a little bit more, we've got a number of subcommittees that are up and running that we're always looking for people to help with. We've got scholarship committees, webinars like what you're doing here, Jon. We're always looking for people to help out with stuff like this, conferences, the annual conference programming. So it's a really great way to get out there and get to know the other like-minded individuals who care about health and safety in mining.
Great, thanks, Bryan. And Glenn, maybe just you've been on on the society for quite a while, the past chair. Anything about the society that you wanted to add that Bryan might not have touched on?
I think Brian gave a very good outline of it. Essentially, what we're trying to do is determine how we can be most relevant to our constituents. And so we've been looking at what's our strategy need to be. And as Brian indicated, there's several things that we are working on right now, and we'll likely touch on those later in the broadcast. But we're really looking to try to find out from our stakeholders what they want us to be focused on.
You said talk about it later in the broadcast. Let's jump into that right now. So, I mean, one of the things that I thought was really important, Bryan, when you and Sam talked a couple years ago, we had poll questions, just like Michelle mentioned, we're going to have today. So, audience, pay attention. The poll questions are going to pop up eventually. But one of the poll questions back then was really about how the Health and Safety Society could add value in 2024 and what it was going to do. And two of the key answers from that were transforming the HS culture and training and education programs. That's what the poll or the audience wanted to see. And this title is collaborating for the journey to zero harm. So obviously collaborating is hearing from the people, hearing from the CIM, from the audience, and putting that into practice. So Glenn, maybe I'll start with you. In 2024, what would you say the Health and Safety Society has done as far as transforming HS culture or helping with training and education programs? Maybe
Well,
just kick it
Brian,
off with your thoughts.
John, as you're certainly aware, transforming a culture is not an easy endeavor. But what we have tried to do is this past year and in years previous, we've always put together a health and safety stream at our annual conference. And the themes and the topics that we pick for that are those that we've heard back from our constituents that they would be interested in hearing about, et cetera. So our main method in terms of the culture is trying to pick out the appropriate topics to have at our annual conference. As you also alluded to, we had a large conference this past October in Toronto that was specifically focused on health and safety themes. And culture was a big part of that, as well as our education. So the programs that we're trying to run from the feedback from our members are trying to look at what they're interested in seeing and have those topics represented in any conference that we put together and in the program outline that we put together for the annual CIM meeting. And of course, we're also in the very early stages of planning for our 2026 Health and Safety Conference. And I'm sure Brian will talk more about that.
Okay, perfect. No, I mean, I think conferences, both the CIM National Connect and the Health and Safety Conference were a big one. And it touches both the, training and education program, but also the transforming culture. I mean, one of the ways and one of the only ways to transform culture is through strong leadership. And if I think back to the health and safety conference that you were the technical chair for, Glenn, you got set up, I couldn't think of any better leaders that could be presenting there and giving their thoughts on safety. Mark Kudafani, Ann Messe, Jody Kazenko, Kelly Strong, just to name a few. It was a great representation. And I think that's one of the value that the society brings is its ability to get larger names, strong industry experts onto a stage to share with the whole industry. Again, that's my thoughts, but Bryan, you're on the panel. What do you think are some of the benefits of 2024 that were helped produced?
Yeah, I mean, I'll echo on what you said about the conference and the lineup of speakers. That we were a little nervous getting the conference together, and I was on the sponsorship committee, and we got a lot of great sponsorship support on that, which was fantastic. So I just want to thank all those sponsors again quickly here. But the talk at the end of that first day, when we're all kind of relaxing at the start of the evening, getting ready to go for dinner and stuff like that, it felt more like we were at a leadership conference than it felt like we were at a health and safety conference. And I think that really rung true with me. Like we didn't have a lot of health and safety professionals up there talking about very technical stuff. We had passionate executives, getting up there, talking about why safety is important to them, how they're driving the culture in their organizations, what they've seen work in the past. I mean, so that was really powerful, and I think that was a great way that we were able to accomplish that one area that kind of came up in the poll back in 2023, the end of 2023, when we hosted this on leadership and culture, was just, getting the right type of speakers to our events, so I would say that was a big part of it. And then, you know, almost everything that we've focused our attention on has kind of touched on the other half of your question there around, learning and development. We have the safety share webinars. We have the stream that Glenn mentioned at our annual convention, with CIM Connect. So in 2024, we had another strong series there. We had a great panel on mental health that, gained a lot of positive feedback. So the whole conference on its own, the one in October. We've got a fatality prevention workshop that I'll touch on later in this discussion. But all of these are about learning and getting the message out there and sharing with industry partners, because a lot of times I think, in health and safety, we like to share, but sometimes we can still be a little bit guarded. We're not as good as we can be. So CIM, the Health and Safety Society, really provides a great forum to break down some of those barriers.
Great point. And I think just getting back to your introduction about what the Health and Safety Society is and the benefit it plays in CIM, I think for me, the benefit is it's not safety professionals. It's mining industry people that are passionate about safety. And so,
Yeah.
Want to be really clear, this society isn't just for safety professionals. It's for everybody in the industry that has a passion for safety. And I mean, I think you both would agree with that concept.
Yeah, absolutely.
Yeah. Well, perfect. You said we'll touch on a lot more, but maybe we're just about a quarter of the way through. Good time for a poll question to make sure everybody's keeping up to speed. So we mentioned before, 2 years ago when we did the survey, training and education programs were a big focus that was selected, one of the top 2 responses. And so we thought what we do this year is try to get to the audience and say, out of training and education, what would you actually like the focus to be on? There's 5 options on the screen: focusing on mental health and wellness, serious injuries and fatalities, safety through technology implementation, which you're seeing a lot now with AI and others, safety leadership, and risk assessment. So if you wouldn't mind, the audience, just take some time, put in your answers. It's great for this discussion, but it also helps to guide where the society is going to focus in 2025 as we look forward to how we can help with the group. And I mean, the one thing is this is coming up. What I've liked since I've been involved with the society for over 2 years is it is a collaboration. It's it's not 1 or 2 people doing everything. It's many people seeing how you can bring more people in, finding the right experts, getting the right network out there to get the right people in place. And I think that's where we've had great success as a society. Maybe as we just give it about another minute for people to respond, or 30 seconds. Bryan or Glenn, anything else on just how the society interacts with its members or other CIM that you think is a benefit?
I think honestly, John, that's one of the areas that we're still trying to work on, figuring out how to get our best feedback from our members as to how we can focus. I think you or Bryan had mentioned it earlier that there is no other national group that can sort of pull together our 10 different provinces and 30 different territories to try to coordinate some of the activities that are going on. And that's certainly a role that we're looking at trying to help facilitate.
Yeah, perfect. Great. Well, I think that's good for the poll questions. Thanks. And again, for those that didn't respond, there'll be one more. So please feel free to give your responses in there. But, it's a pretty close with safety through technology being the leader, and then, serious injury, fatality, safety, leadership, and risk assessment all coming in almost about the same. So we'll touch base on those as we go through the rest of this webinar. I know there's some points we want to touch on in each of those, but maybe I'll just talk a little bit about safety through technology, because automate mining is one of the things we're trying to do. Glenn, I think you did a very good job in setting up the program at excuse me, at the Health and Safety Conference in October last year to make sure automation, AI was in there. And there were some great items, great topics in there that were covered. I think we can touch base on more than that in the future ones. Probably we'll talk about CIM Connect, but that technology of what's going on, both for location of people, location of processes, interference, fatigue management, that was all discussed there. And that's part of what we're bringing forward. Maybe Bryan, if you want to touch on that, or I know the other one that was brought up was serious injury and fatalities. And if there's anything on those areas you want to touch on, I'll let you take the lead, and then Glenn, maybe you can follow in and some stuff from the conference specific to technology.
Yeah, sure. Maybe just on the technology front, and I mean, those of you who know me, occupational health is near and dear to me, and I'll just quickly plug. I think it's early next week. The AIHA mining working group is putting on another free webinar, something similar to this, on real-time particulate monitoring. So another technology that can be used to help control workplace exposures to dust, silica, anything else harmful you have in your place. So I think it's Tech who's leading that discussion through that mining working group. But anyways, I know a few of the people that are working on that, and there's some really neat technology coming out on that aspect as well to a number of the safety related stuff and AI that you've discussed. From the serious fatalities, serious injury fatality prevention, I mean, that's been a space we've spent a lot of time on since the society's been developed. And back in, was it 2022, I think, in Vancouver, we held a full workshop, like a full day workshop during CIM Connect. We had a bunch of industry leaders in there, five of the leading mining companies, kind of giving their overview on what's working, what's not. It's been a big discussion. I think, what I have seen personally over, the few years since we've been really focused in on that is that we're making lots of progress. It's definitely on everyone's radar. If someone wasn't doing it 3 years ago, they're at least trying to implement something now. So we're seeing some good progress there. One of the things now that we've shifted our attention to is we've developed this serious injury fatality prevention group within CIM that Nelson Bodnarchuk's leading up. And this goes back to kind of on Glenn's comment there, where, we're at a bit of a disadvantage in Canada, just the way that health and safety is regulated. It's not through the national body like it is in the US, where MSHA, has jurisdictions of mines across the US. In Canada, it's by province and by territory. And getting all those provinces to talk together and getting the mining companies to speak to one another and really learn from the data that we get, we see that as an area that the society could really help advance. And so that initiative that Nelson's taken on, he put out a call for volunteers. We talked about it at the conference. He ended up getting a group of about 30 people responding. So clearly a lot of interest from the industry in participating and breaking down some of these barriers. And so he gave me a little update. They're basically working on polishing up their project plan for that. They're looking at how they're going to engage with the companies, and ideally what they're going to place their focus on is Canadian mining companies, but not necessarily concerned about where they operate. So if they have international operations, they're still going to try to seek their data, just so we're not, limiting it only to Canadian mines, but Canadian mining companies and their global operations. And we're going to try to get some real data there. And hopefully as that data comes in, they're going to figure out, a positive way to distribute that back out to people to really increase the learnings from serious injuries and fatalities that continue to occur in our industry.
Oh, perfect. And again, I think it's a great initiative and a great way that CIM and the society can support. Amazing with 30 people volunteered already. So it sounds like as far as the the subcommittee, it's in the size it needs to be, it's going to be effective. But I'm guessing, and just that, and Brian, maybe add a few things onto this if possible, the contribution from the rest of CIM, the members, people on this call, would be as that group reaches out or as they try to get information, as the systems or processes set up, talk about how, the listeners, your mining company can donate, provide their information, get that input, maybe thoughts or how they could support without being on the actual subcommittee.
Yeah, I mean, 100%. And that's a great point because the biggest barrier, I think, to gaining this information is, there's always some fears around litigation. There's always, if there's investigations ongoing, how much can we share before the investigation's gone through? But if we're not sharing, we're not really learning from it. So I would just ask people to, really be open when the requests come in, try to contribute, depending on what level of the organization you sit within, you'll have a better ability to influence it. But everyone has an opportunity to influence this, right? Like, so if you're frontline, talk to your supervisor. Hey, I heard about this initiative. It's coming down. Like, I think we should be participating in it, right? Then that supervisor can influence the person above. Or if you're sitting here listening and playing back a recording and you're an executive or in the C-suite and you can really put your hands on it, talk to your peers and your colleagues in the industry and get them to buy in and support it as well. So they're going to try to create tools that will help make this easier for us to share, like clean templates and whatnot, where not too much information is shared, or your company isn't immediately identifiable. But ultimately, we just really want people to kind of trust in the process and buy in a little bit there.
Yeah, good, thanks. Glenn, maybe, just back to you on the 5 topics that people reached out to: technology, risk, injury and fatality, safety leadership, risk assessment, which is one of your keys. Your thoughts, or, what CIM is looking to do in 2025 to help support, and obviously from the answers will help to lean and direct it more towards that, but any thoughts of what we're doing now that sort of tie into the audience response?
Yeah, and first of all, I'd like to add a little bit to what Brian was just saying. It's been somewhat of a hobby horse of mine for a while that as an industry, we're very poor at sharing information. And the fact of the matter is, we're not fatally injuring or seriously injuring people in new ways. They're the same types of incidents that are happening time and time again. And because we don't share the information on them in any sort of a timely fashion, and there's lots of reasons that we're given for that, because we're not sharing the information, we lose the ability to look within our own organizations and see how we could prevent some of those incidents occurring. And, it's a shame that we can't be more forthright in the sharing of our information. With respect to the topics, and I don't know if you want to roll into the Montreal conference that's coming up.
Let's hold off on that one.
Okay.
Maybe hold off on the Montreal one. But maybe like technology, if you think back to the program at in Toronto back in October, I know we had Gus Miner there, we had some other AIs, anything for the group, and maybe just on those actual presentations or any access to them, Glenn, sharing for how they might be able to get access to what took place there.
Yeah, and quite a few of the presentations have been archived and are available through the CIM library. So that's good. And John, to your point, we tried to design the conference so that on day 1 of the conference, it was best practices of today. And then day 2, we were trying to look into the future. And that's where we brought in the AI topics, serious injury and fatalities came up there as well. And we were trying to look at what can technology do to help us to reduce incidents in the future. So I'm certainly, we'll certainly be looking at more of these types of presentations in the future.
Yeah, perfect. Great. And I think whether it's the CIM conference or other avenues, connect, like for those audience out here that are on today listening or listening in the future, please reach out to the society, to members. This is how we try to figure out what do we want on, what does the audience want to hear on webinars, or what are we trying to put at CIM Connect at the conferences? What are we trying to create technical papers on? Just to go back to season 2 of the Safety Share, the last 2 episodes were on BEVs and how to safely operate them in your operations. And then the next one was on proximity detection. And what I like that we do, that CIM does, whether it's through the webinars or through the conferences, is we try to get the industry users, not necessarily just the OEMs or the providers, but the industry users, to talk about the benefits. And we usually demonstrate 2 or 3 different technology solutions. So I think that's beneficial. And you mentioned the CIM library, but you can go to YouTube and get all the old Safety Shares just to download them if you want to look at those other 2. So just a few things there. Perfect. Well, maybe we'll roll into the second poll question. And it gets back, I mentioned, we're touching on conferences and webinars, but if you look at the 5 that are up there, conferences, webinars, newsletters, distinguished lectures, or short courses, how would you best like to see CIM Health and Safety Society get this information out to you, or provide these forums of education and training? We've got the 5 items up there. Please let us know what your preferences are. And as you're doing that, we can see it's a neck and neck battle between webinars and short courses. So that's good to know and good to understand. Maybe just as this is going on, give it another 30 seconds. Glenn, short courses, were there any short courses at or even discussed for the health and safety conference?
We had proposed that there would be a short course on measuring particulates, and that didn't receive the amount of, it wasn't subscribed enough for us to be able to have it. Now,
Yeah.
Given that this was our first conference that we organized, we quite frankly didn't put a huge amount of time into trying to look at what short courses that we could bring out in conjunction with the conference. And I think that's certainly an opportunity going forward when we look at at the organization of our 2026 conference.
Okay. No, I think that's a great point. Okay. Well, Michelle, we got almost 40 subscribers. Obviously, it looks like webinars is the way of the future. So not that I get paid for it, but at least I'll have a job into the future doing webinars and a bit of moderating for the future. Nelson, we're in good shape. If you're out there listening, keep up the good work. We're staying up. But yeah, and so short courses is a good heads up, and maybe we'll just run through this, Glenn. And you touched about CIM Connect to Montreal that's coming up. Maybe just talk on the conferences, short courses, anything that applies to those 5 areas that you think would be useful for the audience.
Sure. We put together the program for Montreal for May of this year is pretty well settled now. And some of the key topics that we have are presentations on critical controls, serious injuries and fatalities, leadership and managing safety, advancing technology, environmental safety and injury prevention, and on mental health. Now, it's interesting when I look at the results of the first poll, where mental health actually scored fairly low, but we've had a lot of feedback on the issue, or not the issues, but the importance of designing mental health. And John, in the past, we've had some webinars on here that have shared with us some very shocking statistics on the impact of mental health issues and substance abuse issues within our mining community. And so in this coming session in Montreal, we're going to have 2 full sessions on mental health issues. And what we're looking to do is to try to, in session number 1, sort of present a lot of info on it. And then in number 2, try to take more of a workshop type approach with more feedback from the audience on what's working, what's not working, and some suggestions. So those are the topics that we've got lined up for this particular session of the CIM Connect in May of this year.
Okay, good. Yeah, and just one of the notes, you mentioned the mental health it was a safety share, and actually it was one of the best attended, and then also one of the best viewed afterwards. And so, I mean, I think that's one of the important things to think about, right? Is a great panel of 60, or a great audience of 60 here that provided some good feedback. The CIM is a larger one, and we've just got so many different opportunities to get input about what the concerns are and try to bring that forward. Bryan, anything on your plate you'd like to add on that?
Yeah, I mean, I actually thought those the responses there were pretty interesting. You know, it was very focused towards webinars, and I think Glenn, that's some feedback that we should be taking. You know, and we're often trying to figure out what do we do with the successful talks that were presented at our conference. You know, the ones that we thought, wow, that was really powerful or meaningful, and I think we got our answer there. We you know we would bring them back here to the safety share and do a webinar on them as well to get them, you know, to a much larger audience and the audience that can't necessarily attend at the conference. And then the other one was really on short courses, and this is an area where, you know, more than once since I've gotten involved with CIM, we've been trying to get a short course off the ground, and we just uh, for whatever reason, the topic that we select or whatnot, it just doesn't get the draw that we're hoping for. So I would love to hear from this audience, maybe through, you know, at the end in the chat or whatnot. Um, what type of information would you like to see in these short courses? Because I do think it's a really valuable learning environment. It's usually small groups, so you can really, you know, dig into a topic. But I think often what happens and where we fall short there is we get a topic that's too focused that, you know, we only have like 3 or 4 people that are interested in, you know, so maybe if there's some more general topics that we could get 6, 8, 10 people, like usually I think we need at least 6, maybe 8 people to run a short course. So if we could, you know, find out what some of these topics might be, we'd love to put some short courses on.
Bryan, you mentioned, and please, for the audience viewers, type in any suggestions you have for short courses or webinars. But just thinking further out, Bryan, because people will listen to this, you know, a week from now, a year from now, is there a
Yeah.
means or some way of communicating or seeing what's going on in the Health and Safety Society to get the opinion across for people or listeners? Is there any way they can do that in general?
Yeah, I mean, we do have a LinkedIn page that, you know, is pretty active. Like people can come on there, they can message us direct if they don't want to put a post, and that's monitored. We've got somebody, you know, looked after. That's one of our subcommittees, and they look after that forum. So that's a good way. And then, I mean, on the CIM website, the Health and Safety Society, all of us that are on the executive are listed there. You can reach out to us, share your ideas. We're all ears. You know, we're really here to serve you. And so if you've got ideas, we would really like to hear about them. I don't know, Glenn, is there any other kind of easy forums for people to get us feedback?
Well, the other thing, Bryan, that we've been putting out is the newsletters. And the
Yeah,
newsletters, as they go out to our stakeholders, have been asking for feedback in them as well.
yeah.
Yeah. And I'd
Okay.
echo. Oh, sorry, Bryan, yeah. Anything
No,
to
no,
add?
go ahead.
Yeah, I'd echo what you're saying from the webinar point of view, because we're putting together the program for all of 2025, and you know, we thought great, kick it off with the society, what's going on. We've got something on mental health, um, actually another one on technology, the connected worker safety, and then one on serious injuries and fatality. So we've got a few of the topics selected for the year, but if there's more that people think about, again, like Bryan said, the forum of, if you're on this call now or future webinars, type in your suggestions, go to LinkedIn, or just go to the CIM website and look at the Health and Safety Society and message any of the directors directly, and we'll get that across to one another to make sure we get that information through. Because I mean, these webinars sort of come through the directors to say, what do we think are important, but it comes from what the industry thinks is important, and the better we understand that, the better we can get that linked up with what people want to hear or see.
Yeah, and I think, like you said, John, there's a unique opportunity this year in that we don't have the full slate
Yeah.
identified already. I think there's 4 or 5 topics that are or slots that are still open. So And if they're well attended and people want them, and we get a few more volunteers putting their hand up, there's nothing saying that we couldn't add an extra one or two to the agenda if we've got the interest there and support for it. So
Perfect. Great. No, thanks. I think that this is just a great topic around how to communicate and how to get feedback from CIM members or the industry in general. And I think that's why we titled it exactly like you wanted, and we said is it's collaborating on the journey, right? It's not that we have all the answers and here's what you need to do. It's we'll help to get everybody that's an expert within the industry together to share those ideas. And the more we can get people to come forward, the better off we'll be. And just we like to collaborating. I know it's part of the vision. Bryan or Glenn, anything you want to add? And Glenn, maybe I'll start with you because I know for the conference last year, the health and safety one, you had a lot of collaboration with, and I'm going to get it wrong, but the health and safety groups within the mid-tier miners, they've got a forum. You linked up with them. Maybe share your thoughts of how we collaborate as a society.
Oh, you're quite right, John. We've been looking for any group. Oh, for it. So for the organization of the committee or of the conference, we also work quite closely with the Mining Safety Roundtable, which has about, I believe, 10 to 12 members approximately. It changes all the time. But we had solicited their input, and we had a couple of people on the technical committee from their organization to help us choose the right topics. We also try to look for feedback from any of the other provincial organizations like the Mining Association of Ontario, and they have a health and safety group which I also happen to sit on, and we were asking them what topics would you want to see presented. So we're definitely looking at trying to expand our outreach, and we're looking to try to diversify on our executive team, people from different regions in Canada, and also different industry, not but different industries, different companies, so that it's not all located in one particular area.
Perfect. Thanks. And Bryan, maybe just before I go to you,
yeah.
Darren and Dan, thanks for your comments on suggestions for webinars, short courses, and other items. But to the audience, we've got about 20 minutes left looking for questions. So if there's any questions you have for Glenn or Bryan, please just type them in. Sorry, Bryan, back to you on thoughts on that.
Like just on the other organizations we're working with, I mean,
collaboration in general. Yeah.
yeah. So I mean, we've worked also with like OSM. We've got some input from them, like some of our sister organizations globally, SME in the USA. Like we've borrowed some of their ideas. Uh, Roy Slack, one of our executive directors, he attends their meetings. He brings back a lot of good information. So, there's definitely some open dialogue there. Glenn, a couple times for the last conference, I know in the early going on, the organizing of that, and then also in that critical control workshop we did a few years back in Vancouver, we worked very closely with ICMM on putting those together. So yeah, we're definitely out there looking to work with anyone. We've reached out to Mining Association of Canada. So yeah, if there's organizations out there that kind of have a shared vision, we want to be aligned and working, right? Because they're reaching a group that we can't necessarily reach on our own. We're just looking to be a collaborative partner and help advance this journey to zero.
Just if I can, Bryan, add on to that, you mentioned ICMM, and many people may not know that the CIM is now an associate member of the ICMM. So we're able to get in and participate more fully with the discussions that take place at the ICMM and to be able to benefit from the information that they have on their hub setup. So that's something down the road that will certainly help us.
Yeah.
Perfect. Great. And Zach, Mayor from Glencore, thanks, Zach, for the comment. But, he said the John T. Ryan winners would probably be a great forum to share what they had going on with their success. And I think that's just a great idea to go back and try to pull in some of those those winners to get their comments. But
If I can, John, when we first started the safety shares, or not the safety shares, but the safety stream at the annual conferences, and we've been doing them about 12 years, I would say now. But the first 5 or 6 years, we focused one session on JT Ryan winners. And yes, we've been there, we've done that, and it's likely time for us to have another look at it and see if we could bring them back for another year.
no,
Well,
that's great.
yeah, I was going to say, Glenn, it's a good point because, one of the challenges we had in bringing them back was getting the commitment, making sure that the right people that could speak to the reasons and, what they were doing well at their sites. They weren't always the people that were attending the conference, but, thinking back to our poll and webinars, I think there might be an easy win right there. And, it creates an easier forum if we can do it virtual like this to share some of the learnings from the JT Ryan Award winners. So
Yeah.
that's a great comment from the audience there. Thank you.
Yeah, no, I think it's a terrific comment. And, obviously there's a discussion on lagging indicators and leading indicators. And so beyond just the John T. Ryan winners, those in the industry that think they've got, great programs or they've got a recipe that may not have shown all the success they want yet, but is in that direction, share it with this group and we'll figure out how to get it across to others. And again, as everybody knows in the industry, everybody learns and you take what you learn and you apply it or you don't apply it, you judge it, you use your own best interest and you figure out how to can or cannot apply to your organization. But just thinking about awards, Bryan, safety awards, does the Health and Safety Society have any involvement in CIM Health and Safety Awards or safety awards at all? Or?
Yeah, so I mean, Gord Winkle, who's on our executive, he's heavily involved in the John T. Ryan Awards. There's also the Safety Leadership Award that we've I think got arm's length involvement in. And then the other award that comes to mind is the Distinguished Lecturer Award. And that's something that I think we've only seen maybe one nomination, an award come out of our society on. But I would love to see Glenn, you're putting up your hand, but it's a bit blurry there. Is there more than one? Two. Yeah. Okay. So two out of that. But regardless, I think if we, if there's people out there in the industry that see someone in their organization making a huge difference in health and safety in the workplace, regardless of what their role is, consider nominating them for a CIM award. You can go on the CIM website. You can see the categories there. Um, the more we can recognize people, the more it will encourage other people to, to seek that recognition as well. And we'll get some good names and we'll learn about all the great things that people are doing out there and hopefully get them recognition for it and share it with our community. So yeah, good question.
Perfect. Perfect. And, we had a question/comment around how do they make sure they get communications from the Health and Safety Society. So a couple things. One, make sure when you join CIM or if you're a CIM member, you're picking your societies and pick the Health and Safety Society as one of the societies. If you're not getting our regular communications, whether it's webinars that are coming out or newsletters, again, not to make it difficult, and I apologize, but go into the directors, send an email to any one of us. We'll work through to make sure what's going on. I think there is a little issue with the newsletter currently that will get rectified for distribution, so that should be resolved soon. But if you're not getting anything, send it along to a director, and we'll figure out how to link your email up with the information we're sending out.
Yeah,
And
and I think the backup plan there is our LinkedIn page too. If you find us on LinkedIn, the Health and Safety Society, and you follow us there, we make sure that, anything that we're trying to get out to our members, like actually one important thing I'd like to share during this call is we will be having our AGA in May. So this was a good reminder, right? So we'll be having a call for new directors. So if you're looking to become more involved in the society, we will be sending out a call in advance for that, and you can submit an expression of interest and put your name forward for something to be voted on there at our AGA in May.
perfect, great. Glenn, anything, last comments you wanted to provide as far as the society goes, or?
Last comments. It's been really gratifying to see the Health and Safety Society evolve from our original committee work that we were doing and move to now where we're much more established. We've got a few dollars in the bank that we can start to look at trying to do some other things. And we've been working on our strategy to see where we can go in the future and how to best align with what our stakeholders are. There's a huge amount of work yet. And we also need to link in with the other societies better, because the Health and Safety Society definitely cuts across all of the individual societies within the CIM. And I think one of the areas that we need to work at more in the future is better understanding what's going on within our fellow societies.
Perfect. Bryan, maybe I'll turn it over to you for one last point, and you touched on it quickly, but you mentioned scholarships, and I know, Glenn mentioned the society's growing, and with that comes the conference and more funding, and then what do we do with that? Maybe just take a couple minutes, and I know it's not firmed up, but what are some of the thoughts?
Yeah, so I can speak to the scholarships. We've teamed up with CIM Foundation to help with awarding some scholarships for health and safety. And but in order to do that, we need an evaluation committee. So this is an area that we're actively looking for participation. So if someone's looking to get involved with the society, but doesn't have a lot of available time, this might be something. It's probably once a year you'll get asked to review, maybe a dozen applications, kind of top and rank those. So that would definitely be a good volunteer opportunity, and we're trying to see how we can give back a little bit more there. There's a couple scholarships currently set up, but we're exploring if there's an opportunity for a little bit more, or to add a little bit of dollar value to the existing ones that are there. And then just if there's time, like I'll say it, like to kind of echo Glenn's comments, it's been pretty remarkable. When we first switched over to a society, I think we were 12 people or something, and that was 3 years ago, and now we're up well over 300 in membership. And you've heard about all the great things that the society is doing. So I just if you're on the fence and not sure if you want to contribute or do a little bit more, I would really encourage people to reach out and volunteer. CIM's a great organization. It's very rewarding to work with them. They're very well organized, and they support us by helping us run webinars like this in the background. They've got a lot of bandwidth in the background that's really helping us facilitate all the different things we're trying to do. So.
Perfect. Well, maybe you talk about bandwidth in the background. Michelle, you might as well come back on. I'll just do a little bit of close before you wrap us up with what you normally do. But I think if I can summarize, from what Glenn and Bryan, you both said today, it's really listening to the industry, the CIM, figuring out how you can get things out there. Some great work done on the webinars, on SIF, on the conferences. In the short term, Glenn, it sounds like have everybody on this be ready for Montreal. There'll be the AGM for CIM, but also the one for the Health and Safety Society will take place on the Sunday, and a great panel and streams for the technical side of it. We'll continue with the webinars through the year, and then into 2026 is the next health and safety conference plan, and we'll think about short courses. Anything I missed with a synopsis of what we've taken away, or what we're going to try to do as a society based on this call?
Sounds like you covered it pretty good to me.
I thought it was well done, John.
Yeah,
Michelle,
thank you.
take us home.
Okay, thanks, John. And thank you, Glenn and Bryan, for joining us today. And a special thanks to Eldorado Gold for sponsoring today's episode of the Safety Share. I'd like to thank all of our attendees and ask that you please fill out the short survey that pops up on your screen at the close of the webinar. A link to the video recording of this webinar will be emailed to you tomorrow. Stay tuned to the CIM calendar of events on CIM.org for Season 3, Episode 2 of the Safety Share, and we hope to see you there. And also, by the way, all of the topics that you have put into the questions, the things you'd like us to see, those are recorded and they will be in front of Jon and the Health and Safety Committee for
And I'll just add, Michelle,
possible webinars.
For those that are listening now afterwards, please send the emails in with the same suggestions like the comments that were here. So
Great. Thanks very much and have a great day.
Thanks, everyone.
Thank you.